Let me say it straight. Most root canals on molars are a ticking time bomb. And if you're over 40, it may be the worst dental investment that you ever make. Hey everyone, it's Dr. J, and today we're cutting through all the fluff. Let's talk about root canals versus implants. I get this question a lot. The answer really depends on who you are, where the tooth is, and how long you want that fix to last. Now look, root canals definitely have their place in dentistry. They're often the right call for younger patients. Why? Because we want to preserve teeth while the rest of the mouth and jaw continue to develop. Keeping natural structures in your 20s helps to avoid more complex issues down the road. But here's the problem, especially when we're talking about those back teeth, the chewing teeth called molars. Molar root canals are very tricky. Why? Well, for first, there's multiple roots that can be curved. They're harder to clean. Often they're connected almost like a spiderweb network. There can be accessory canals. The bacteria load is higher because of this. It's been said that in many cases that it's almost impossible to get all the bacteria even with a perfect root canal. On top of that, you have more force and chewing pressure on these teeth. Now that's a brutal combination and a big reason why molar root canals have a higher long-term failure rate. And when they fail, you're not just losing the tooth, you're risking bone loss, reinfection, and worse, systemic inflammation that lingers and really taxes your immune system. That's where dental implants come in. Dental implants, especially when planned digitally and placed with precision, don't just replace your teeth. They replace function, they can replace bone, and most importantly, they replace confidence. They're not vulnerable to things such as dental decay or cavities, acid erosion, some of the things that break down teeth. They're immune to nerve damage, and when done right, they can last decades, many times longer than a root canal ever could on a high-risk tooth. And I hear it all the time, but doc, isn't it better to save the tooth? Well, again, it depends. Is it a front tooth, a back tooth? Sure, if the tooth is worth saving. But when you have a cracked molar that's got curved canals with complex anatomy that may be visible on a 3D scan or it might not be visible. You've got a large chronic infection that's affecting your body. It may not even be symptomatic. You may not feel it. That's already causing significant bone damage and taxing your immune system. Now you're entering the danger zone. Saving that tooth with the root canal becomes a gamble. It's not a solution. So if you're over 40 and the dentist says root canal, I want you to pause and ask, is this the best long-term decision, or am I buying time for a much bigger issue down the road? In my practice, implants aren't just about fixing teeth, they're about protecting your health, your time, and your peace of mind. Now I know this can be a controversial topic, so please feel free to drop your thoughts and questions in the comments below. Thanks again, this is Dr. J, and we'll see you soon.